Good morning, everyone, and Happy New Year. We
Morning.
are so excited to be with you all today, and we are more excited to have been able to take this journey with Walden and the Social Change Department. So we are going to jump right in. The picture that you see before us are, we named ourselves Dr. B, Dr. C, and Dr. J. And we decided that in the midst of everything that was going on with our project, about 6 months in, the emails, the Zooming, the free conferencing, the back and forth wasn't working. So we took it upon ourselves to get together. So about 7 months into the project, we decided to meet. So we collected ourselves and our researches and our laptops, and we went to Aiken, Minnesota, a cabin on the lake, 100 miles from everywhere and everything. The best things were ducks and geese and deers, and a wonderful maple syrup uh, area where you learned how maple syrup was made. Next slide, please. So our study was about older adults and caregivers. We looked at food policy, healthcare in rural America. Now, all of us had a background in concerning about policy, nutrition, and older adults. And we came together because we somehow fell into each other on ResearchGate and found that we had this love of older adults. Dr. J was in rural America in Iowa. I had taken care of my mom for 20 years as an informal caregiver. And Dr. B had a wealth of information on food policy and social policy. So that's how we connected. We did a mixed method study, which was very challenging after the more we involved ourselves. And that was another reason why we decided to come together. So we looked at homebound adults and informal caregivers, their quality of life in rural America. Now, we all know the challenges of rural America. And one of the concerns that I had was how were they being nutritionally fed in that area with the type of demographics we were hearing about supermarkets being 10 miles away and the different churches and organizations who were sending food to older adults at certain times of the months and years. So what was going on in between all of that? I also was looking at the fact that how were the caregivers feeding older adults with chronic diseases? Because that was another issue that concerned us. So we looked at the nutritional health and the unmet needs of the caregiver. What information did they have to successfully take care of the people that they had in their world and do the appropriate things for their health and wellness? So we did the study looking from the standpoint of what was the need of the caregiver versus what was the need of the person they were caring for. Next slide, please. So our literature review was very interesting. We went through over 115 to 120 articles. We did a secondary review of literature because we wanted to see what was out there. We looked at brutality impacts the quality of life, and we found that there was quite a bit of access issues with the older adults, specifically at home, regarding the food, the social networks, and the healthcare aspect. Dr. J had a personal experience, and we always have to, keep our biases in check. Living in Iowa, where there was a lot of problems with needing information as a caregiver on what to do with certain situations. And it was very difficult to keep having to find resources. And then when she found the resources, it was days or weeks before the resources could actually come to her. So that was another area that we found in the literature that based on where the homegrown person was, it took time for them to get the certain needs that they required. And so that was very concerning. We also realized that the resources that was available were resources that many people did not know about. It wasn't until something happened, if they were hospitalized, then they had knowledge about resources. But even after that, when they left the hospital and back in their home environment, there still was distance as problems, not enough people to come and take care of the people who had needs. And then also a huge issue was respite for the informal caregivers. And so one of the things we looked at when we found our themes, next slide please, was we realized that it was very important that they looked for people who we could educate, and that when we educated them, that's what they needed. They knew that they had to take care of the person in their world. The spouses were quite a few of the caregivers. The adult children were caregivers. The unfortunate part, many of the adult children in rural America had moved away. And so they had jobs and families of their own. And so what happened is they ended up seeing a lot of friends and strangers becoming caregivers who didn't have resources and knowledge to take care of the older adults. So that became a real interesting challenge. So one of the things that we realized in our study was the caregiver needed more knowledge to be able to take care of themselves in order to take care of someone else. There was a lot of information about the caregiver's quality of life because they were trying to operate in an area that wasn't as friendly if they had been in urban areas. So a quality of life for the caregiver, believe it or not, was a conversation that we heard about in looking at our data. What can I do to take care of myself so I can take care of others? And so the autonomy of the caregiver became a very interesting theme in all of this. Now, what was interesting is we were trying to decide how the qualitative and quantitative part married each other, and it really ended up being that the caregiver needed to have knowledge and tools, not long distance, but closer to them so that they can have access to them when they need it. One of the one of the articles that I read made a comment of, I started drinking, I started smoking, because at some point in time I got so frustrated with not getting what I needed as a caregiver that I kind of lost myself. So autonomy was something that they really were interested in trying to address. And so we were also very interested in saying that we needed to find resources. Next slide, please. Resources and companies that would help with this situation, because it was indeed a gap. So training was critical to the informal caregiver. Policies were out there. We saw a lot of policies about Alzheimer's patients, but not necessarily about general chronic diseases. So we were hoping that this research would align us with opportunities to talk to people on social policy issues, on public policy issues, on how we can have sustainable resources in rural America for people who are caregivers, taking care of others. So, and the social implication here is the quality of life in rural America is very important. It seems to be a constant struggle with people who are in rural America, and people should not have to leave from where they're comfortable to take care of themselves and those in their world. So that's kind of how we ended up. We are doing some ongoing projects. We have looked at a couple of journals that we're interested in, a couple upcoming conferences that we got our eyes on regarding older adults in rural America. And so we are looking forward to continuing on. Thank you so much, everyone.